Here we go. We are live, Madam Chair.
Okay, thank you. Good morning, everyone. Welcome to the Board of Health meeting for Friday. We'll start again. Good morning, everyone. Welcome to the Board of Health meeting for Friday, October 22nd. It is 10:07, and I apologize. We've had a few technical difficulties, but we're online now. So we'll call the meeting to order. And Mary, please start with the roll call. I do have regrets from Warden Hicks and Warden Jackson.
Sue Patterson.
Present.
Alan Barfoot.
Present.
Brian Milne.
Present.
Brian O'Leary.
Present.
Chris Peabody.
Present.
Mitch Toolin.
Present.
Helen Claire Tingling.
Good morning, Mary.
Nick Saunders. Also present, Dr. Era, Matt McMurray, Kaylee Hooper, and Mary Henry.
Thank you, Mary. At this time, I'll ask if there's any amendments to the agenda. Seeing none, I'll ask for a motion, mover and seconder, to approve the agenda as presented. Helen Claire moves it and Brian Millen second. All in favor? That's carried. Does anyone have a disclosure of pecuniary interest or a conflict of interest? And of course, if one should arise during the meeting, you may declare it then. Item 5, we have recognition, and I'll turn it over to Dr. Era.
Thank you, Madam Chair. With great pleasure, I would like to recognize former mayor and ED and former board member for the great service she's provided on both fronts as a mayor and as a board member during the emergency. And I would like to present on behalf of the board a commemorative crystal to Mayor Edie for her service. It is specifically for the Davidson Center space to be used as a hockey hub, and before that as field hospital. And that center provided the vaccine to thousands of people, was replicated across the province, the country, and worldwide in certain countries, and benefited many people. Thank you so much for your leadership. It has been a privilege to work and serve with you.
Well, thank you, Dr. Era, and thank you to the members of the board as well. I played a relatively small part, but I was an enthusiastic supporter of the initiative at the Davidson Center. It was a wonderful example of creativity, and I think Dr. Era and the staff earned a lot of that credit. But it was creativity and collaboration and efficiency coming together. And the Davidson Center, Hanover, Own Sound, we just sort of heard about it. And then the next thing you know, I was lining up with a family member to go through and actually see the model in action. And it was amazing how everything came together, and the collaboration among all the different agencies, the counties, the lower municipalities, and the volunteers and service groups. And the comments I got, the feedback I got from being there a few times was people could not believe that number of people was going through so efficiently and easily. I just thought it was a wonderful idea. So I have to congratulate everybody involved, and I wish you all the best. I think in the past year, we're in a much better place, and the vaccination hubs have been a big part of that. So congratulations to everyone involved. Thank you. And I do miss you all. Just keep up the good work.
Thank you very much, Anne. We appreciate appreciate everything you've done, and thank you for taking the time to join us today. We're so glad to see you. You know, we're getting back to normal, and we miss you too. So
I still live in the town of Kincardine. So if you're over our way, I know a lot of you don't have my current contact information, but I think maybe Sue does, and a few of you do have it. And I'd be very glad to see you. We've fixed up our backyard. I've had time to concentrate on that. So you're most welcome.
sounds like a backyard barbecue coming up.
Yes. Yeah, we need that. So I will leave now and let you carry on your meeting, and keep it up. You're doing a great job.
Thanks, Anne.
Thank you.
Okay, so next on the agenda is the adoption of minutes, and we have regular board meeting minutes from September 24th. I need a mover and seconder to approve those minutes. Alan Barfoot and Chris Peabody. Any further discussion with those minutes? Seeing none, all in favor? That's carried. We also have item 6.2 is the Board of Health Executive Committee meeting minutes from October 15th. And that's the meeting we were reviewing, starting to review policies and procedures. I need a mover and seconder for that. Brian O'Leary, and seconder, did I see your hand, Chris? Chris Peabody, thank you. All in favor? That's carried. Item 7 is correspondence and news releases, and I'll turn that over to Dr. Era.
Thank you, Madam Chair. Correspondence-wise, there is one correspondence from the Board of Health for Simcoe Muskoka District Health Unit, and it is in general outlining the pressures on public health units and requesting immediate and ongoing provincial government financial support for local public health. The recommendation is to receive on September 24th meeting, we endorsed similar correspondence from a different health unit. The difference between the two is minimal in a way that this one is requesting immediate cash flow. There are a number of health units across the province. We're not one of them where there is a cash flow issue, and there has been request for loans from banks. So more or less, we endorsed something like this before, and the recommendation is to receive it.
Okay, I don't see any hands raised. So if you'd like to continue on with the news releases.
News releases, the number of news releases is less than the previous months, which is a good indication that the COVID situation is continues to be under control and tapering down. And the main correspondence or media release there is related to expanding eligibility for third dose. The rest of them are quite operational and have the purpose of providing information to the public on specific incidents, whether it is a dismissal of cohort or other.
Thank you. Any questions regarding the news releases? Can I get a mover and seconder to Brian Millen and Mitch Tulin? Thank you. That's to approve the correspondence and news releases as presented. All in favor? Carried. Thank you. 8.0 is the Medical Officer of Health update. Again, Dr. Era, over to you.
Thank you, Madam Chair. If I may just take a minute to bring up my notes. So, Madam Chair, the update for this item is twofold. One of them is related to the COVID situation. The other one is related to the recovery and environmental health. Quite a different subject, and it's good to talk about recovery. The MWH report related to the COVID situation, we continue to have optimal control over the pandemic locally. We have quite the low number of cases, in no cases or hospitalization, and the death as well across Grey Bruce and across the province. There has been announcement for lifting capacity provincially. A number of municipalities from Bruce County lifted their emergency status in the past few weeks. The vaccine front, we have an average or a number that's a bit lower than the provincial average, and we are waiting on next steps for providing the vaccine. We have provided the vaccine for third dose. Sorry, I should explain there. Third dose has been provided for immunocompromised, according to the provincial direction, to all long-term care and high-risk retirement home. That was completed in September. Retirement homes, the rest of retirement homes, we received the direction to provide it to them in this month. The next on the horizon is 70 plus and Indigenous community. So the third dose will be provided to them most likely in November. We have not given the concrete direction, but they heads up to plan for that, and we have completed plans on this. We're working with the municipalities and other partners to ensure the delivery of that. The children between 5 to 11, Pfizer company provided the data to NACI, the National Advisory Committee for Immunization, and that process is undergoing. If there is approval, it is anticipated to be late November, and we are prepared to provide that in community centers in each and every municipality in Grey Bruce. Then that would be for both the 70 plus and for the children under 12. The other part of the update, if I may share my screen, is related to recovery planning and recovery progress. I'll share 6 slides or 6 paragraphs. And it has been a while since we presented on anything but COVID. The Environmental Health and Tobacco Enforcement Team. Those are 2 teams that work together on multiple facets of our public health services. Health inspectors, PHIs, are responsible for 3 of the 9 Ontario public health standards, and I'm going to provide a summary of those as we go. Tobacco and enforcement and education officers are also part of that team, and they provide multiple functions related to tobacco control and reducing risk from those substances. During the pandemic, both teams have been heavily involved in the emergency, and that would have to most of the time reduce the services that we provide or the frequency of it. And sometimes it actually increases that service. For example, inspection of farm workers on farms, housing for farm workers. This usually happens once a year or so. During the pandemic, there is definitely more functions, but in general, we need a few months to ramp up to what pre-pandemic was. And this is a picture, a couple examples of the services we provide. For food safety, we inspect and we follow up on compliance and complaints from over 1,500 food premises. There is a disclosure system for these inspections. We post the the data and the compliance level. There is non-inspection work related to risk assessment, application review, consultation, and complaints and follow-up to complaints, licensing for different facilities. We also work with the provincial and the federal food recall and the federal level for food inspection and recalls. We provide a training for food handler certification, which is unique to public health. Water safety, whether it is in the private and public drinking water systems or the recreational water, we provide services on many fronts, including inspections of 466 small water drinking water systems. We provide education. We ensure higher standards in providing drinking water. We follow up with complaints. We work with different partners to ensure these systems are operational and the health of the public is ensured. Public health inspectors respond also to adverse water quality incidents, around 150 per year. And there are way more functions than that are listed on this paragraph. Safe water for recreational water, we look after over around 200 facilities. And we ensure that there is compliance, we ensure there is education provided, and again, the quality of the water for the users and for the public is looked after. A healthy environment is another aspect that this team looks after, and it's mainly health hazard investigations and following up with complaints, following up with potential infractions. Temporary foreign worker housing is another aspect, as I mentioned earlier on. Environmental health standards is another set of activities, whether activities in engagement, planning, developing, and implementation, evaluation of the strategies related to reducing the environmental health hazards. Getting close to the end of it, and infection disease prevention and control, whether it's related to rabies or related to vector-borne disease. Rabies is a very complex program. We work with many partners, whether it's animal control or healthcare system, vet clinics, and other partners. We have a high number of dog bites in Rabies, and we follow up with these investigations, dog or cat or animal bites in general. And we provide the vaccine, the support to the healthcare system in assessing the risk and then delivering the vaccine and administering the vaccine consultations. Infectious disease related to vector-borne, whether it is Lyme disease or mosquito bite-related diseases, mosquitoes and ticks. We do surveillance of non-human surveillance of tick surveillance, and we work with the provincial and labs to ensure results are delivered in timely fashion. Tobacco enforcement is the final part of this evaluation or update. Sorry, I tend to present way better if I'm not reading or trying to read. Tobacco enforcement has many functions of surveillance, inspection, and compliance, and education. We have around 500 or 480 facilities shops to look after. We have in 2019 around 1,951 tobacco vape vendor inspections, and it's obviously one of the most challenging aspect of the the work that this team does, the fact that these products have been approved recently in the recent years on many fronts, and there is increase in using them. Tobacco has been under control and going down for the longest time. So there is more work there to be done to ensure that we're meeting we're meeting the standards, to ensure that we're heading in the right direction to a healthy future for all the age groups or the population in Grey Bruce. I'll stop there, Madam Chair, open to questions as always, and I apologize on the choppy presentation. There is some flashing on the screen here, and I'm trying to read off it too.
Thank you, Dr. Era. Okay, any questions for Dr. Era or comments?
A question, Sue.
Go ahead, Brian.
Thank you. Dr. Era, thank you very much for speaking to the plan to vaccinate the 5 to 11-year-olds. I'm just wondering what rationale or planning was considered doing the vaccination of these individuals in the clinics or in the community centers versus going to the schools. In the school, I would think you'd have kind of a captive audience.
Through you, Madam Chair, a very good question, and it's actually one of the first potential plans to go to schools. The age group between 5 to 11 most likely would require a parent or family member to be with the child, and several of the schools have policies that would only allow vaccination of children, not allowing parents to be on premise. And it is the other layer of it. It is better practice to provide the vaccine to both family members, the child and the parent, and vaccination of parents in schools also is not possible through these policies. So we had to go to different routes, and there are different mechanisms of delivery, whether it is pharmacy, primary care, and the clinics that we would provide in community centers.
Thank you very much, Dr. Era. If I might, Madam Chair, I had another question.
Please go ahead.
Okay, it has absolutely nothing to do with COVID-19, at least not directly. Food trucks throughout Grey Bruce. Who inspects them regarding to their cleanliness or their food storage or handling practices and all that business?
So, Madam Chair, I probably would have to connect with the manager to get the details on this, because in 2019, I believe the premises that need to be inspected would not include food trucks unless it's high risk, unless there's a complaint. But I want to double check if the regulation changed since then. Okay.
Because I have received some concerns from a couple people regarding a couple establishments. So maybe I need to touch base with some staff there at the health unit. Thank you.
Certainly.
Further questions for Dr. Era? Please speak up if I don't see you.
Oh, Madam Chair, Helen Clare, please.
Yes.
Through you, Madam Chair, a couple of questions. Before I get to those, though, I'm interested in what Mr. Milne just asked. So if I may, I'm just wondering who, if it's not public health, is there another agency that is responsible for those food trucks? And the nature of my questions are to do with Dr. Ara's report said that there's a high number of animal bites and a low level of rabies now in the community, which is the latter is a great point. I'm wondering what the principal source of the high number of animal bites are. Why is there a high number? And I'm also wondering, since there's a low level of rabies, is there a particular source of the rabies or a particular area where rabies is concentrated? Thank you, Madam Chair.
Thank you, Dr. Era.
For you, Madam Chair. We'll start with the second question, the rabies question. Grey Bruce actually has the highest level of number of animal bites. And we looked at data in 2018 when I first started to identify exactly the questions that you mentioned. The bites, are they from domestic animals versus wild animals? Are they in a local resident versus visitors? And it really across the board, there is more outdoor activities in Grey Bruce, more visitors that contributed to this number. We work on different levels in prevention and education, and you can appreciate that many of the visitors that arrive to Grey Bruce are not exposed to the material that we put out. We put out for our residents, and the visitors are for a short period of time. So we will just have to work on different strategies to reach that population before they arrive, whether it's at provincial level or working with other health units where most people come from. I'm not sure if I answered that question completely there.
Helen Claire?
Madam Chair, through you, I'm even more confused now.
Sorry.
No, so my question is around if there's a high number of animal bites, trying to drill down to what that is. What I understand from Dr. Ara's response, Madam Chair, is that there is a large number of visitors that come into the community who are not receiving our educational materials. So am I to conclude from that that the high number of animal bites is to do with visitors to our community?
I apologize through you, Madam Chair. My apology. There are a number of bites related to residents, related to visitors. It's what I was trying to convey. It's multifactorial. There are domestic animal bites, dogs and cats. There are farm animal bites as well. Sorry, I'm trying to think of the second part of your question, which is the rabies, less rabies or on the decline.
So I'll take full responsibility for trying to bundle my questions there. I think I've made it more difficult for you. So if I can stay on this first question for a little bit until I can resolve the answer, Madam Chair, would that be acceptable to you?
Yes, please go ahead.
Thank you. So I think what I'm hearing from Dr. Ara is we haven't defined the reason for the high number of animal bites, but public health is looking into it. Would that be correct, Dr. Ara?
We were looking into it before the pandemic, and definitely during the pandemic, that whole project was put on the side. The data that we reviewed from previous years, it's multifactorial. It's not one category or the other.
Thank you so much. Moving to the second part of that question now, there's a low level of rabies, and I'm wondering if the source of that rabies, if we have a sense of that, since it's a low level, is it confined to a specific area? Are we able to say that before the pandemic it was bats or raccoons, or do we have any idea of that, or is that also something that was parked and will be picked up now after COVID?
The rabies has been identified in animals, raccoons, foxes. The south part of the Grey Bruce is more prevalent, and that's related to the raccoon migration from the United States over the past 10 years. It happened over two periods where raccoon rabies was identified in Niagara region, then around Hamilton, then spread out a bit further north. Nevertheless, it is a low number of cases in animals that we identify per year.
Thank you. That's wonderful news, Madam Chair. I'll just circle back now to my colleague, Brian Mills' comment about food trucks. And I'm understanding from Dr. Ara's response that we're not sure if that's a public health authority or some other. And I'm just wondering what that, for me, I had always assumed that public health was looking after that. And now I have to kind of think, oh, is somebody looking after that? So if it's not public health, do we know what organization would be responsible for these food trucks? Thank you.
Food inspection is public health work. In wagons and trucks, if they're crossing from different area, from a different health unit, that's where the trouble or the difficulty or the challenge can be. So at some point it was, in some health units, was decided that only if there is a complaint, and there are quite the number of complaints if the operator is not following the best practice. So we follow up with complaints, we provide education and inspection, and we can lay charges or request, put restrictions if they need be. So it is public health that takes care of those inspections, but as I mentioned, they might not be based on every single operation until there is a complaint.
Thank you so much.
Okay, I have Chris and then Alan.
Yes, thank you, Chair Patterson. Dr. Era, I'd like to ask some questions about the vaccination rates in Grey Bruce. Today we're at 32nd out of the 34 health units. And despite the best efforts of our staff and all the pop-up clinics, we're still down there at the bottom. Has there been any analysis why our health unit has seemingly low vaccination rates compared to other areas of the province?
Dr. Era?
Through you, Madam Chair, the number of vaccines provided in Grey Bruce is, like you rightly said, less than the provincial average. But if you look at the margin difference is quite minimal among all health units. The main reason, in my estimate, why people might not be getting the vaccine is the relative safety that we have in our area. There are certain measures that put in place in other health units. One of them is a letter of instruction from the medical officer of health to all children aged 12 to 18. If they want to participate in sports, they must be vaccinated. We did not use this measure in our health unit for obvious reasons. We have quite the control over transmission in the sport activity and organized sports. There has not been outbreaks, not even a single outbreak. There was a number of cases, but not outbreaks. Versus other health units that implemented this measure, there are active outbreaks as we speak in some of these health units. So the level of intrusiveness in our policies reflect the risk assessment that we have conducted. Not to say that we might not go that route down the road if the need be. And you look at the other aspect of this, that age group, that's where the main variable between our health unit and other health unit could be is this age group. If we look at it in Grey Bruce, it's around 10,000 children or so, let's say, theoretically. We vaccinated 70% of them, there are 30%. If we introduce this policy with the intention to providing vaccine, it may very well backfire if the parents decide to pull the children out of the activities. So the child will be deprived from the opportunity to have good mental health because of their participation. And there isn't the alternative benefit of reducing risk, it's already reduced. So those are two main factors why we have not introduced these policies, and probably contributing factor to a lower vaccine level. Nevertheless, we're inching up similar to other health units. And I'm monitoring this aspect quite closely.
Okay. Second question, with the vaccination rates among employees with, for example, the Bruce County long-term care homes, we've been very public about our vaccination rates, and I've expressed concern about one of our homes, which was quite far behind. And we did work very hard to bring that rate up. And we do believe that both our homes will be up around 90% once we've worked on that issue with our vaccination policy. What about our schools, the Catholic School Board and the Public School Board? Are their vaccination rates for their employees available?
Dr. Era?
So the Chief Medical Officer of Health directed Health Unit to request information from schools for the purpose of managing outbreaks or suspect outbreaks early on. So we do have the data, or we're collecting the data that started about a few weeks ago, and we have the data from schools, mainly students. I don't believe we have it for staff.
No. Okay. I know you're busy with all sorts of other things, but I do think in the public interest, those school boards, I'd call upon them to release their numbers so that parents can know what their vaccination rates of their teachers are. And as I said, we've had to put a lot of work in our long-term care homes to get those vaccination rates up. And I think the school board director and the trustees should be doing the same.
Through you, Madam Chair, it would be very helpful to have the vaccine rates on every sector in every location. However, for the management of outbreaks, it might not make much difference. And I suspect that's why the provincial direction would prioritize the areas that are highly sensitive where impact can take place. Nevertheless, we can, it's not something that we didn't work on, rather it's something we might not need to work on.
Yeah. Okay, thank you.
Thanks, Chris. Okay, Alan?
Thanks, Madam Chair. Going back to the report, Dr. on the tobacco enforcement, does the multiple cannabis locations that have started up, do they also fall under Andrew's jurisdiction then to inspect them?
Correct.
Okay, thank you.
Okay, any further questions for Dr. Era? Chris?
Yes, with regard to this year's flu shot, last year, I recall I didn't get one because there seemed to be a shortage of that, and I didn't want to take a flu shot from somebody else. If there's sufficient supply, would Dr. would the health unit be able to arrange for the members to get a shot so that we promote the fact that we're pro-vaccination here?
Madam Chair, yes, of course we can, absolutely, and we can publicize the event if the board member wishes.
Good idea. Any other questions? All right, moving on, Dr. Era, modernization update. Is there anything to share with that?
There is no update, Madam Chair, on that item.
Thank you. How about 8.3 opioid situation?
The opioid situation, Madam Chair, we continue to provide the core program, and we have been expanding our other functions as part of the recovery. The main item we're working on is the mobile unit, the van outreach with the Grey County and different partners, the EMS and other outreach organizations. And this has been so far progressing really positively.
Any further questions for Dr. Era? That's good news about that, the mobile unit should help. So I need a mover and seconder to receive the medical officer of health update as presented. And I can't see everyone, so please speak up. I have Alan and Brian O'Leary, all in favor. I'm going to assume that's carried. Thank you. Item 9 is corporate services, and that's Matt.
Perhaps if Dr. Era would, there we go. Thank you.
Thank you, Madam Chair. On the corporate services financial update, I'm pleased to present we have some new funding that was announced very recently, back on October 20th, a few days ago, for $120,000. This is for infection prevention and control hub program, something that this health unit has been working on. Dr. Zayed has been very active in this, as our MOH and a team of people. So this funding comes as a piece of good news to us, and it's meant to cover congregate settings. It is for $120,000 and will it is one-time funded and is 100% from the ministry. So that was an announcement that was to us. We've continue to track our Q2 financial report information to the ministry, along with the associated funding that we anticipate back from that shortly. Our financial statements reflect a shortage in revenue, and that's because we haven't recognized what we've applied to for the ministry yet, but it is well within that envelope. That reflects an actual shortage or deficit so far this year of $450,000, well within the envelope that we've asked for additionally. I would say that our COVID time tracking numbers have begun to reduce as the waves have passed and we've responded. And I think that also shows, we continue to show through our financial statement. The capital projects all show on budget and remain in surplus. I think all good news on those fronts. Open to questions, Madam Chair.
Thank you, Matt. Any questions for Matt? Chris?
Yes, Matt, with the $450,000 shortfall, just to clarify, you anticipate the province will cover all of that? And I just wondered if there's any risk of the counties having to cover a portion of that.
I can make reference to two things. The first one was the minister's Elliott letter to us saying that all extraordinary funding for COVID would be covered for 2021. That's very much within that envelope. So I think there's very, very little risk that the ministry will not cover any of that. Therefore, the county's not having to cover it at all.
Right. Anything further, Chris? No? Okay. Other questions? I don't see any. Thanks for that report, Matt. We need a mover and seconder to receive the August 2021 financials as presented. We'll take Chris and Brian O'Leary. All in favor? That is carried. Thank you. Item 10 is other business. Does anyone have any other business? Brian O'Leary.
Thank you, Madam Chair. I just had a quick question for Dr. Era. Our orientation training session for November 9th, will there be an information package sent out to us? I'm just wondering about if it's going to be a Zoom meeting, if there is some kind of preparation we could go through prior to the meeting.
Thank you. Dr. Era?
We have not received anything from the trainer. However, I will connect with them and ask for that specifically. It's a great idea. Thank you.
Thank you.
Okay. Anything further? Helen Claire?
Hi, sorry about that. Just to confirm the training, there were so many emails back and forth. I'd just like to confirm the date and time of the training, if I may. I'm seeing the 10th at 3 o'clock. Is that what everybody has?
Mary?
November 9th at 10 o'clock.
The 9th at 10.
Yes.
Thank you.
Okay.
And lunch will be served.
Yeah, right. Okay, good. Anything further? Okay, so that is the end of our meeting. We're getting, like I said, getting back to normal with our meetings, which is good. Item 11 is adjournment. I need a mover and seconder. So I have Brian Millen and Alan Barfoot. We are adjourned at 10:52. All in favor? That's carried. Have a good weekend, everyone.
Thank you,
Well done.
everybody.
Well
Bye,
done,
everybody.
Madam Chair.
Good weekend.